Okay, so I woke up this morning as I always do, and first thing in the morning, I check my email. I'm always excited to see who's contacting me, looking to touch base this morning. I was particularly glad that I did. There was an email from the UK. The subject said urgent, so naturally got my attention. The letter was from a gentleman in the UK named Alex. He wrote, last night my mum, M-U-M, that's what they call mom in England. Last night my mum was admitted to the hospital for pains in her upper stomach and back, vomiting, which was then followed by confusion and memory loss, with her not remembering the month, year, and what she was doing or what was happening, etc. She seemed to loop around every few seconds, asking the same questions. They did some blood tests and an x-ray, and they were talking about possible gallbladder problems, which, as Alex points out, can cause similar symptoms to mental confusion and pain, etc. And guess what? They want to take her gallbladder out. Alex winds up his letter saying, I really just wanted to know what I could do to help prevent them from operating and removing her gallbladder or any other part of her body. Many thanks, Alex. So here's the thing about the gallbladder. Despite the fact that 500,000 gallbladders are removed from Americans every year, despite the fact that doctors will tell you there's no real need for your gallbladder and that you can still digest your food and live a healthy, productive life without one, despite the medical craziness, nonsense that is the conventional wisdom about the gallbladder, this is not an organ, bodily structure that you want to remove simply because you got gallstones. The gallbladder is a digestive structure, and that means that by definition, a gallbladder issue is a digestive issue. It's a food issue. It's an eating issue. To understand the importance of the gallbladder, we got to understand the importance of bile. The gallbladder is a bag o' bile. It's a bag that holds on to bile, and bile, next to water and blood, is probably the most important fluid in the body. Bile has two main roles in the body. It helps us dissolve fatty substances from our food, breaks apart fatty vitamins like vitamins D and E and A and K from our food. It breaks apart essential fatty acids from our food. It helps break apart minerals from our food and makes all of these easier to absorb into the blood and into the digestive tract and then into the blood. And then secondly, bile helps clear poisons out of the body. Poisons like old hormones, poisons like bacteria, poisons like prescription drugs. That means bile, as it's cleaning out poisons and breaking up fats, can become sticky and sludgy, just like dirty engine oil. And it's this sticky, sludgy bile, this dirty bile, that can clump up, forming so-called stones, and clog up little tiny ducts in the gallbladder and cause the tremendous agony that's associated with gallstones. The medical term for this gooky stuff is bile sludge. That's what they call it, bile sludge. In fact, bile sludge can be thought of as miniature gallstones. In other words, this sticky bile, this bile sludge, is the beginnings of gallstone formation. And bile, because it's recycled, it goes round and round and round from the liver to the gallbladder to the intestines, back to the liver and back to the gallbladder and the intestines. It kind of circles around the body. It can ultimately become very sticky and very sludgy, and it can clog up the gallbladder piping, and that's when your doctor's going to tell you he's got to take out your gallbladder. There are 20 million Americans who have problems with gallstones, resulting in hundreds of thousands, 500,000 Americans having their gallbladders taken out. Now, I don't know whether these patients/victims have been told about the implications of having their gallbladder removed, but the odds are pretty good they haven't. And having your gallbladder removed is going to wreak havoc on your body for the rest of your life. It's going to cause skin problems. It's going to cause digestive problems. It's going to cause difficulties absorbing fats. It can cause gas and flatulence, just misery. And if we don't know what the gallbladder does or what it is or how important it is for good health, it's going to be a lot easier for some medical professional to tell you that you're going to be fine without a gallbladder. And I'm telling you, you're not going to be fine without your gallbladder. You're going to you're going to have higher risks for all kinds of degenerative health issues, including skin diseases, especially skin diseases, constipation, diarrhea, all kinds of issues. If you suspect that you got a gallbladder problem, that's not a reason to have your gallbladder taken out. If you suspect you have a gallbladder problem, that is a good reason to start focusing on the foods you're eating and on your digestive health and wellness. In fact, no matter what your health challenge is, it's always a good idea to focus on digestive health and wellness and food choices. If you're dealing with a gallbladder problem, get yourself on Longevity's Ultimate Enzymes after all your meals. The Longevity Ultimate Enzymes not only contain digestive enzymes that are specific for helping break up fats, something called lipase, but they also contain bile salts. All important bile salts that are so important for gallbladder health. Keep your organs, people. They're all important. In addition to using the ultimate enzymes, probably a good idea to use the Fucoidan Z. Wonderful for all digestive health issues. Fucoidan Z is almost like a panacea tonic. It's great for blood thinning, great for digestive health issues. It's got immune properties. It's anti-cancer. Just a wonderful nutritional supplement, the Fucoidan Z, or of course the Z Radical as well. And when you're using your ultimate enzymes, by the way, it's always a good idea to wash it down with a little bit of apple cider vinegar. Last but not least, and this is very underappreciated when it comes to the world of fats and fat metabolism and gallbladder health and liver health, for that matter, is probiotics, good bacteria. For gallbladder health issues, for fat malabsorption issues, for all digestive health issues, get yourself on the BioLumin Nightly Essence. Not only will the BioLumin Nightly Essence help improve fat absorption because of its probiotic contents, but the BioLumin Nightly Essence is also a good source of digestive enzymes. All right, I'm Pharmacist Ben, sitting in for Dr. Wallach today. Thank you for joining us on the Dead Doctors Don't Lie program. Our number is 831-685-1080 or 888-379-2552, toll-free. Love to hear from you if you got questions about health, nutrition, prescription drugs, or if you just have a success story you'd like to share. We're coming back with more good health information on the Dead Doctors Don't Lie program. Don't go away. I'll be sitting in for the next 44 minutes or so with my good friend and colleague, Billy Graff. What is up, Billy? Good to talk to you again.
Talk to you, Billy. There we go.
How's it going?
Good to talk to you again, Ben. It's always nice to work with you. Hey, I've got good news and bad news.
Okay, which do we want first?
Well, let's give you the good news. The Alzheimer disease rate and other rates of dementia is falling in the United States and other rich countries. That's the good news about the epidemic that's still growing simply because more people are living longer than before. The bad news is we are still, compared to 30 years ago, way above the Alzheimer's rate that we were. And
wait, you mean in the last 30 years or compared to the world?
Compared to 30 years ago, our Alzheimer's rate everywhere is way higher than it was 30 years ago.
Even though it's dropping?
Even though it's dropping.
Got it.
And so that's the good news and the bad news. Dementia rates are also down in Germany, which is kind of interesting. About 5.4 million Americans and 35 million people worldwide have Alzheimer's disease, the most common form of dementia. They're saying in this article it has no cure and current drugs only temporarily ease symptoms.
That means there's no drug cure. That's what they mean. They can't take your brain out. If they could take your brain out, they probably would do a brainectomy. Oh, you don't have Alzheimer's disease anymore because we took your brain out. But that's the medical model for you.
But now you're not doing anything with the rest of your body because your brain went away.
Right. But that's the logic. If you got gallbladder pain, they take your gallbladder out. If you got menstrual cramps, they take your female organs out. If you got a lump in your breast, they take your breast off. Right? So if you got a headache, just chop off your head. You got Alzheimer's disease, let's take your brain out. Obviously, that's ridiculous, right? But that's the medical model for you. Here's the deal, Billy. Alzheimer's disease is arthritis of the brain. It's the same thing. It's a blood sugar issue. It's a digestive issue. It's the same stuff. You know, you ever hear that saying, same crap, different day?
Oh, yeah.
Metaphorized, you know, that's not how it goes, but you know what I'm talking about. Well, guess what? All diseases are the same thing. Same crap, different day. Same crap, different day. It's all the same stuff, you guys. When the body breaks down, the breakdown is generic, but the expression is diverse. The breakdown is the same. The way the body breaks down is generic because all our bodies are the same. We all have a heart. We all have a liver. We all have a digestive tract. We all need our mighty 90 essential nutrients. We all need to stay away from the crappy food. We're all the same that way, but how the disease shows up at the end of the day, that's different. That's the expression. That's the symptom of the breakdown. The problem with the medical model is it bamboozles us into believing that our problem is the symptom. Our problem is the expression. It is not the symptom. That's why they say there's no cure for Alzheimer's, because there's no cure for a symptom. You can't cure a symptom. You can only hide a symptom.
Well,
you can only mask a symptom. You can only go ahead. I'm sorry. You can only disguise a symptom. Go ahead.
No, that's our medical. That's our modus operandi, isn't it?
I know.
We in Western medicine we treat the symptoms,
and then we say that there's nothing we could do. There's no cure for it. There's no drugs for the symptom because there isn't. A symptom is the end. It's the excretion. It's the final result. It's how the body has resolved the problem. A symptom is how the body has fixed, its attempt anyway, to fix the breakdown. So what's the deal? How do you handle it? You go to the point of breakdown. You don't treat the fruit, you treat the root. And the root of all disease is going to be found in the digestive system, the blood sugar system, and then if you want one more piece of the puzzle, the adrenals and the thyroid. But you don't really need that, because if you take the bottom of the triangle out, the foundation of the triangle out, the top point's going to fall on its own. So the foundation of our triangle is going to be digestive health and blood sugar health, period. End of story. How do you deal with digestive health? Number one, you patch up the gut. Number one, you eliminate problem foods. If you don't know what those are, you do a food diary where you link your digestive problems to specific foods and eliminate those foods. Step number two, you get yourself on the Biolumin Nightly Essence. You get yourself on the Fucoidan Z. You start using your ultimate enzymes after all your meals using a little bit of apple cider vinegar. In addition to eliminating problem foods, that's going to go a huge way. It's going to take you a huge way towards eliminating your digestive health issues. Step number two, you focus on the blood sugar problem. You guys, you don't believe me? Google Alzheimer's disease and diabetes. Google dysglycemia. Google messed up blood sugar and Alzheimer's dementia. We'll finish this up when we come back from our break. I'm Pharmacist Ben, along with Billy Graff, sitting in for Dr. Wallach today. You are listening to the Dead Doctors Don't Lie program on the CBS Radio Network, and we'll be back right after this. I'm Pharmacist Ben, sitting in for Doc Wallach, along with Billy Graff, and we're talking the general way the body breaks down, Billy. I call this the bright side philosophy. You know why I call it the bright side philosophy? Because it's the good news. You know, if you try to take care of your diseases or your health challenges by approaching this symptom and that symptom, this organ and that organ, this structure and that structure, you're going to go crazy. And that's what the medical model wants. It wants us to go crazy, so we just turn to the white coat authority and ask him what to do. Take my gallbladder out? Sure, whatever. Take my uterus out? Whatever. Take it out. You know, need to put me on a beta blocker drug to poison my heart because I have an arrhythmia? Sure, whatever. Let's do it. But if we understand that our breakdowns, our health challenges, our symptomology is really the manifestation of just generic, standard operating procedure breakdowns in the body, then we can begin to address our health challenges for reals, as Ollie G says. For reals, for reals. We address it at the root, and we change the fruit. We address it at the root, and we change the fruit. The first point of the root is going to be the digestive system, always. Always, 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 always. In fact, Billy, if you want to be a hero for somebody who has a health condition, just get them on the Biolumin Nightly Essence. Just get them to focus on digestive health and wellness. You can't not get better. Not going to say completely, but you can't not begin to get better. Second step is going to be blood sugar. And that means stabilizing your blood sugar by eating more protein, by making sure you're using your essential fatty acids, your ultimate EFAs, and by getting on the Healthy Start Pack, the Mighty 90 Essential Nutrients. Once you start using your micronutrients, once you start intaking the B vitamins and vitamin C, and the fatty vitamins D, E, A, and K, and your minerals, what we call the Mighty 90 Essential Nutrients, once you start to get your body saturated, immersed in these Mighty 90 Essential Nutrients, you'll find you're eating less food. And you'll find you're especially eating less sugar. Billy, how many times have you heard people say they lost weight when they started on the Beyond Tangy Tangerine or on the Healthy Start Pack?
Almost everybody I've talked to.
Right? That's the first thing you notice. Why? It's not a weight loss product. It's because it's the micronutrients, and that's why we're overeating. We're overeating because we're nutritionally deficient. Over the last 200 years, really beginning of 12,000 years ago, but at an accelerated pace over the last 200 years, we have figured out how to separate, how to divorce micronutrients from calories. And the end result has been we get lots of calories, but we're not getting the micronutrients. So we eat the calories, and the body expects to get the B vitamins, it expects to get the vitamin C, it expects the zinc and the selenium, and the vitamin D and E and A and K. It expects these micronutrients with the calories. That doesn't happen. So we eat the calories. The body doesn't have the micronutrients. It's not satisfied. We go get more calories. Again, the body doesn't have the micronutrients. It's not satisfied. We go out and get more calories, and this goes on and on and on. And we call that, at the end of the day, diabetes. Or we call it prediabetes or dysglycemia. Or we call it, at the end of the day, malnutrition. Yes, we are the starving obese in this country. We're malnourished, but we're overcalorized, if that's the right word. So what do? You get yourself on the Mighty 90 Essential Nutrients, all of them. The Ultimate EFAs, the Beyond, we made it so easy for you. The Ultimate EFAs, Beyond OsteoFX, Beyond Tangy Tangerine. It'll cost you about $3 or $4 a day. It'll be the best $3 or $4 a day you ever spent. It'll be like a cup of coffee and a donut. And you'll have all the nutrients that you need to get you off of this treadmill, this round and round and round of calories and lack of nutrition and calories and lack of nutrition and calories and lack of nutrition. All right, I'm Pharmacist Ben. You're listening to the Dead Doctors Don't Lie program. We're coming back with your phone calls. 831-685-1080 is our priority line number, or 888-379-2552. Toll free. We'll be back right after this. Time to hit phones. Who's first on the line? Billy?
All right, let's go to St. Louis. And Tony, you're on with Pharmacist Ben.
Hey, Tony.
Hey, can you hear me?
What's up, my man? We hear you loud and clear. What's going on?
What I'm trying to find out is I have two things I'm going to ask you about.
Sure.
Okay, I just got like 30 days ago your the 90 for Life pack. I've been on that. Does this tangy tangerine kind of make you to lose weight or anything?
Well, it's not going to make you lose weight, but it'll keep you from munching and snacking because of the micronutrients. A lot of times, as we were saying in the last segment, a lot of times we feel unsatisfied or dissatisfied in terms of being full or satisfied from our foods because we're not getting the nutrients we need. Tony, did you ever experience this where you eat a big meal, a Thanksgiving dinner, say, or you have a big meal at a restaurant and you're full, and then an hour later you're in the refrigerator looking around for some more food? Has that ever happened to you?
Yeah, well, see, I'm one of those guys, I can eat a lot, but I don't gain weight easily.
Well, hang on, my man. I'm trying to get a point here across. Did you ever experience that where you think you're full and then an hour later you're looking in the fridge for more food?
Yeah.
It happens to all of us. Happens to me. Happens to all of us. What is that about, really? When we're full after we eat, but then an hour later we need more food. What that's about is the body not getting its nutrients. The body not getting what it needs. The body needs calories, true. And it needs protein and fats and carbohydrates. That's true. But it also needs what we call micronutrients. Those are vitamins. Those are minerals. And to a certain extent, some plant nutrients. If the body doesn't have the vitamins and the minerals and these plant nutrients, it's going to send us out for more calories because it's expecting to get these micronutrients with the calories. When that doesn't happen, we keep eating the calories, and we keep eating the calories, and we keep eating the calories in our body's attempt to try to get the micronutrients. But if you get the micronutrients in the Beyond Tangy Tangerine and the Healthy Start Pack, you'll find that you don't need as many calories, that you're more satisfied, and you're satisfied longer. And this is where weight loss comes in. Beyond Tangy Tangerine is not a weight loss product. It's nutrition. And that is what allows you to eat less and ultimately to lose weight. And I'm telling you, almost everybody who starts the Beyond Tangy Tangerine and the Healthy Start Pack loses weight. And sometimes significantly, sometimes 5 pounds, sometimes 10 pounds, but sometimes up 50 pounds, 60 pounds, 80 pounds, 100 pounds. I've talked to people who've lost 150 pounds. Myself, in Denver, I've talked to one lady in particular who lost almost 150 pounds using the Healthy Start Pack and the Beyond Tangy Tangerine and all the other supplements that we talk about on the Dead Doctors Don't Lie program. So it's not the BTT. It's not the specific Beyond Tangy Tangerine product that's going to allow you to lose weight. It's the micronutrients, the vitamins and the minerals. What was your question, my friend? Did you have something that you want to ask?
Well, the second one has to do with now, I'm a musician for maybe 20 years. I'm just wondering.
I'm not understanding what you said. It has to do with what?
I have like tinnitus, like ringing
tinnitus.
in the ears.
Yes. You have ringing in the ears. How long have you had that?
Probably for about at least 12 years.
Okay, well, then you got something else going on. I remember I was talking, I don't know if you heard us earlier, I was talking about the fruit and the root. The fruit is the symptom. The fruit is the expression of the disease process. The fruit is how we see our bodies break down. But the breakdown is occurring. It's percolating underneath. It's behind the scenes. It's like if you're playing music, the audience will see the band, but they don't see the behind the scenes, all the sound equipment and the equalizers and all the things that are required to project the sound. Likewise, your tinnitus is the music, but there's a sound man behind that who's making the music happen, and we got to get to the sound man if we're going to take care of the sound of the tinnitus. Hang tight, I'll tell you what I mean. Give you some specifics when we come back from our break. All right, we're back on the Dead Doctors Don't Lie program, talking to Tony in St. Louis about tinnitus. Tony, real quickly, because I want to get to a few more calls here, my friend. Tinnitus is ringing in the ears, as you said. It doesn't have to be, it could be any kind of weird sound. Some people will get a buzzing sound or a jangling sound or a ringing sound, whatever. But tinnitus, as I was saying before we went to the break, is only what we're seeing. It's the symptom. But underneath, you've got problems that are percolating where you don't notice them. And our job when we have a health condition like tinnitus is to figure out what's going on inside our bodies. Almost always you're going to find some kind of digestive health issue, and you're probably going to find some blood sugar issues as well. So here's the deal. The fact that you can eat all that food and not gain weight, that's a sign that you may be at the beginnings of diabetes. Sometimes that'll happen when people are starting to have messed up blood sugar. So I'd be focusing first and foremost, I'd be focusing on the digestive health issue. See if you can notice any digestive problems and then link those up to specific foods and eliminate those foods. Secondly, get on the Biolumin Nightly Essence, and then also the Ultimate Enzymes and the Fucoid Z. That's all in the interest of patching up your digestive system, helping it work more effectively and efficiently. Get yourself on the Healthy Start Pack and the Sweeties product. The Sweeties to help stabilize your blood sugar. Blood sugar problems are almost always behind symptomology, especially long-term kind of chronic symptomology. And then the micronutrients are also going to be important, especially the B complex, which is important for all brain health issues. I call the B complex the brain vitamins, vitamin brain, because they're important for all brain health issues, be it ADD, mental confusion, Alzheimer's, dementias, or as tinnitus, which is a head or brain issue. And so the Healthy Start Pack featuring the Beyond Tangy Tangerine, the Ultimate Essential Fatty Acids, which are anti-inflammatory on their own, and the Beyond OsteoFX with the magnesium. Minerals can also be involved. Mineral deficiencies can also be involved in tinnitus, especially zinc and also magnesium to a certain extent. Thanks for your call, Tony. I hope we answered your questions, and good luck with everything. Who is next on the line, Billy?
Let's go to Idaho and Della. Della, you're on with Pharmacist Ben.
What's up, Della?
Hi. I am having problems with tendinitis in my jaw.
Tendinitis.
Tendinitis.
Tendinitis, not tinnitus. Tendinitis, okay.
Yeah, tendinitis. I said it wrong the first time.
No worries. Tony had tinnitus. You have tendinitis. Tendinitis is an inflamed tendon. Anytime you have inflammation, something is getting into the body that's activating the immune or the inflammatory response. It's a defensive reaction. Tendinitis is an inflamed...
I knew that much. I just...
Good deal. That's perfect.
I'm on the healthy bone and joint.
Well, hang on. That's great that you got that, because that's probably the most important thing to understand. When there's inflammation in the body, tendinitis is inflammatory. That means the body is defending itself against something. Now, your inflammation could be secondary, and the body could be defending itself against destroyed cells or destroyed joint tissue, destroyed cartilage tissue. But in any case, it's some kind of defensive response. When there's a defensive response, you want to ask, what is the body defending itself against? And that means something is that's getting into the system, that's activating this kind of this defensive response. Almost like when a terrorist or an enemy plane comes into domestic territory, all of a sudden the Air Force will scramble. If the terrorist is on the ground, the Army will come to the rescue, etc. That's kind of like our immune system. So inflammation is like the Army coming to the rescue. Your question, the only question you need to answer, is what is the Army attempting to protect itself or protect the body from? And you'll find it's usually some kind of food or something that's getting in through the digestive tract. So once again, we want to be focusing on digestive health, just like with Tony. We want to be focusing on the Biolumin Nightly Essence, eliminating problem foods, digestive enzymes. The Ultimate Enzymes are neat because not only will they help protect or prevent stuff from getting into the body, into the blood, that is activating this immune response and causing inflammation, but the Ultimate Enzymes are actually anti-inflammatory on their own. Not only will they help you with your food, but they'll help you with your tendinitis. They'll help you with your pain. If you have sinus pain, they can help you with that. If you have joint pain, they can help you with that as well for arthritis. So the Ultimate Enzymes have a dual function. Number one, they're going to help you digest your food, which will reduce inflammation. And number two, if you take them on an empty stomach, they'll also have anti-inflammatory benefits. A couple other things that you're going to want to try, of course, the Healthy Start Pack, that goes without saying. And on the Ultimate EFAs, I'd be using 9 Ultimate EFAs a day for tendinitis, 3 in the morning, 3 at night, 3 in the afternoon, and 3 at night. And then Also, you might want to consider the glucogel caps for helping rebuild that cartilage. The glucogel caps are also very effective for helping rebuild the digestive lining as well. So again, like the Ultimate Enzymes, you'll get multiple benefits. So Healthy Start Pack, focus on problem food, Biolumin Nightly Essence, Fucoidan Z, or maybe the Z Radical, Ultimate Enzymes, and then the glucogel caps if you want to throw one more thing in there. Thanks so much for your call, and I hope we helped you out. Good luck with your tendinitis. See if we can get one more call in, Billy.
All right, let's go to Rodrigo in Monterey, California. Rodrigo, you're on with Pharmacist Ben.
Hey, Rodrigo.
Hi, how you doing? Nice meeting you in Santa Cruz a while back.
Good talking to you on the phone. What's up? How can we help you?
All right. My uncle was diagnosed with prostate cancer, and they told him he had the 0.1 in his prostate cancer, and then it went up to 0.5. And then a few months later, they told him that he doesn't have any cancer, and all he has is some spots.
That's called a false positive, and it's very that's called a false positive, and it's very common. That's why you got to be really careful about having your prostate taken out or having it radiated or all the other horrible things they do to that poor little walnut-sized gland that's such an important part of our reproductive system, the male reproductive system. You know, when we get older, most people are going to have prostate cancer. On autopsy, they find that 80% of folks have prostate cancer if they're over the age of 75 or 80. So, prostate cancer is not the end of the world. There's a lot of things that you can do, especially if they've told him that he's negative for it, but he's got an inflamed prostate. I take it. So here's a couple of things for you. First of all, surprise, surprise. All inflammation, you need to focus on digestive health. The prostate is especially responsive to fats and fatty vitamins as well. So really, when you're focusing on digestive health for prostate issues, you want to focus on fat absorption or fat malabsorption. There's lots of things you could do to improve the body's ability to absorb fats. I'll tell you what those are here in a sec. But fatty nutrients have a specific relevance for prostate health, and there's quite a few of them. Vitamin E is very important. Vitamin A is very important. Omega essential fatty acids are important. Zinc is very important. Zinc is not a fat itself, but it requires a functioning fat metabolizing system. You'll get all of these nutrients in the Prost FX from Longevity, so call your Longevity rep and ask them for the Prost FX. You definitely want to be doing the Healthy Start Pack. That goes without saying. And because of the fat malabsorption component, because of how the absorption of fatty nutrients is so relevant for prostate issues, you want to do all the things that we talked about with digestive health and wellness, focusing on fats. That means the Ultimate Enzymes after all your meals. And it's always a good idea to use a little apple cider vinegar with your Ultimate Enzymes. The Biolumin Nightly Essence, the probiotics, the good bacteria. That's one of the hidden benefits that you don't hear a lot of folks talk about with the Biolumin Nightly Essence is it's very important for helping the body process fats. And because of fat malabsorption syndromes and fat malabsorption being so common, the Biolumin Nightly Essence can help a lot of symptomology, a lot of various symptoms. So Biolumin Nightly Essence, 3 capsules in the morning, 3 capsules at night, and then the Fucoidan Z coats the digestive system. Noni juice can also help coat the digestive tract too, so you might want to get on a little bit of Noni, and you can call your Longevity rep or talk to your Longevity rep about that as well. So Healthy Start Pack, all the things that we talked about for the digestive system and for digestive health and for digestive wellness, and of course the Prost FX, which is designed specifically for helping improve prostate health. Thanks so much for your call. Appreciate it, Rodrigo. Hope we helped you out. And got time for one more? We're going to a break here, Billy. Oh, I guess that means we're going to a break. All right, our number is 831-685-1080 or 888-379-255. You're listening to the Dead Doctors Don't Lie program. I'm Pharmacist Ben along with Billy Graff sitting in for Dr. Wallach today. We're coming back with more of your phone calls on the Dead Doctors Don't Lie program on the ZBS Radio Network right after this break. Okay, we are back on the Dead Doctors Don't Lie program. Got one more segment to talk to you at 831-685-1080 or toll-free 888-379-2552. I'm Pharmacist Ben along with Billy Graff sitting in for Dr. Wallach today. And who's next on the line?
Lovely name, actually. Eldora from Idaho is on. Eldora, you're on with Pharmacist Ben.
What's up, Eldora?
Hi, Ben. Thank you for taking my call. I just had a call today from my brother, whose close friend got diagnosed with cancer I guess he has glioma on the brain, malignant blocks on his liver, asthma, high blood pressure, arthritis, and joint pain.
Okay, well, you know what? I'm glad you called, because that's a classic case of everything I was just talking about, how we have all these crazy symptoms in our body, and if you just feel like throwing up your hands, you don't know what to do. Am I right?
Right.
You don't know where to go. You don't know what symptom do I take care of? What bodily structure do I deal with? How do you deal with a body that is falling apart with so many different symptoms? All right. Well, here's how you deal with it. You cut to the chase. You know, a long time ago, I don't know if I have enough time to talk about this. Well, Google the Gordian knot. A long time ago, there was this thing called the Gordian knot, and nobody could figure out how to untie the Gordian knot. I'm going to give you the short version of the story of the Gordian knot. Nobody could figure out how to untie the Gordian knot till Alexander the Great came along. And you know what he did to get to untie the Gordian knot? He took his knife out and he cut it, or he took his sword out and he cut it. And that's how you got to deal with this problem. You can't go. The knot is too tangled. So you got to get your knife out and you got to cut through the knot. And how do you? This is for all degenerative diseases, but especially if you got multiple symptoms, which I think of as a knot or a web, a complicated morass. So what do? You take your knife. Your knife to cut through the knot is number 1, focus on digestive health. Number 2, focus on blood sugar health. And number 3, make sure you're on the Healthy Start Pack, which covers everything. So what do you do for digestive health? Well, again, and I know I'm beating a dead horse here. I apologize for repeating myself, but this is just how the body breaks down. And likewise, it's how the body heals itself. You focus on the health of the digestive system by eliminating problem foods, linking diarrhea, loose stools, constipation, heartburn, gas, bloating, nausea, vomiting, discomfort in the digestive tract of any kind to specific foods, and then eliminating those foods. For a gentleman who's as broken down as you described, 0 tolerance for any problem foods. That alone is going to make a huge difference. But there's more. The next thing you do is you start to patch up the digestive system using the ultimate enzymes after all your meals. And it helps to wash your ultimate enzymes down with a little apple cider vinegar. Helps activate things. Then you want to be on the Fucoidan Z, 3 capsules a day, and the Biolumin Nightly Essence, 3 in the morning, 3 at night. That's your digestive component. The next part is going to be the blood sugar system. And again, like with the digestive system, once we take care of the blood sugar system, symptoms will tend to fall away. And you'll lose weight on top of that, too, once you start to take care of the blood sugar system. You know, it's funny. There's a new, not that new, it's about 15 years old. I actually did a talk on it at the Longevity Convention back in 2000. Some of you guys may remember this. There was a syndrome that people are talking about called metabolic syndrome. And if you ask your doctor or healthcare professional about metabolic syndrome, they'll tell you, well, of course, that's caused by blood sugar problems. That's caused by messed up blood sugar. And then you ask, what is metabolic syndrome? And they'll tell you, well, it's pretty much everything, because everything is metabolic. It's high blood pressure, it's weight problems, it's cancer, it's elevated cholesterol, it's mental health issues, it's like depression, all of it, everything, you name it, it's metabolic syndrome. Metabolic syndrome is blood sugar problems, insulin problems. That means everything has a blood sugar and insulin component. Is that too simple? Well, I'm sorry, but it's true. You know, I know it's simple, but it's true. You fix the blood sugar. So after the digestive system, you get your client on the Sweeties product. You have him restricting his intake, or as I say, with a guy that's as broken down as you described, 0 tolerance, not just restrict his intake, for anything that spikes his blood sugar or his insulin. That means fruit juice and fruits and pasta and rice and potatoes and cereals and processed foods and, you know, all the foods we love to eat so much. And weaning himself off of that and replacing it with the Slender FX, replacing the calories that he's getting from these kinds of food with vegetables, not fruits, but vegetables, stabilizing the blood sugar, and then, of course, getting on the Healthy Start Pack, the Beyond Tangy Tangerine, the Ultimate Essential Fatty Acids, and the Beyond OsteoFX. And I guarantee you, you're going to start to notice results almost instantly, certainly within 24 to 48 hours if he does everything correctly. Thanks for listening, folks. I'm Pharmacist Ben. For Doc Wallach, for Billy Graff, for Doug Winfrey, for everybody at the ZBS Radio Network, have yourselves a wonderful, beautiful, awesome day. We'll talk to y'all later, folks. Bye for now.